So what I find is that the timeliness for these discussions is really good. I find that there is an appetite from policymakers and politicians to move away from interest in access issues only and start focusing on outcomes and how the system can demonstrate its value. And I think that thinking about things like avoidable mortality or avoidable death actually can resonate both with the public, but can be also a way for health system policymakers and politicians to demonstrate that their investments in health turns into into reductions in avoidable mortality. So maybe a few ideas. I think that the first thing is that the data has to be more broadly available, and especially to the research community, so that they can do more analysis and research that will be actionable by policymakers. I think that we've seen actually lots of movement from governments, quality councils, lots of other organizations who are very interested in avoidable mortality and trying to see what they can do to improve and further reduce avoidable mortality, especially for minority groups. And so they are taking the equity dimension into consideration. I think that organizations like ours, the Canadian Institute for Health Information, can certainly facilitate a pan-Canadian dialogue, and there is plenty to be learned across the country. We have some jurisdictions, some provinces have made tons of progress over the last 30 years, some others have made more moderate progress. So I think the conditions are really met to boost the sort of public profile for a more outcome-based indicator, performance indicator like avoidable mortality, but also go more granularly in understanding some of the drivers, some of the policy interventions that would be evidence-based and could support improvement across the country.